Good afternoon, everyone. Hi, I'm Liz Krueger, State Senator. Welcome to my webinar on Medicare Parts A, B, C, and D, changes you can make to your coverage. I think this will be particularly relevant for people who are just starting off with Medicare, but important new information about the program overall that hopefully everybody tuning in will have will walk away learning more. I want to start off by reminding everyone that, as usual, we have a closed captioning option available. If you're a viewer on Zoom, you check in by live transcript in the meeting controls to start viewing closed captioning. And if you're viewing us through Facebook Live, you will see a setting button on the bottom right-hand corner of the video. You click on CC for closed captions to activate the process. And for people who have never used closed captions, if you have any hearing issues at all, it can be incredibly valuable to have the key information that's being provided in a typed form on the bottom of the screen you're looking at as a supplement to hearing us talk. So I encourage everyone to give it a try because you might find it incredibly valuable for this event, but also for when you're watching perhaps a TV show. There's closed captioning on many shows now on your TV, or when you're watching any of those streaming channels. It's a really valuable tool for people to experiment with. This forum is being recorded, and everyone who RSVP'd will receive an email with links to the event video, an event survey, and the resources that are posted in the chat within a few days from now, along with our presenters' PowerPoint. So you're going to get a lot of information today. Don't think you have to write it all down. Some of the information will be in the chat, and you might want to copy that for yourself, but you'll get all this information in a couple of days after the event, and you can always follow up with any of the resources that you've heard about. Let's talk about vaccines. If you're trying to locate where to get a COVID booster and or your flu shot, because we really need both this time of year, you can click on the New York City Vaccine Finder, NYC Vaccine Finder. You'll see it in the chat. And that should make it pretty easy for you to find a place to be boosted or to get your flu shot. And this is a bad flu year, so let's not forget there's always a bunch of diseases out there that are trying to get us, and we want to win the fight against them. I've already had my booster and my flu shot. Finally, my district is changing January 1st. Because of redistricting, some of my current constituents may not be represented by me anymore in January, as significant areas in East Midtown and Yorkville are now in other senators' districts, while Roosevelt Island, more of Chelsea, and Midtown heading west have been added to my district. The link to a map of my new district is listed in the chat, but please rest assured, if you get my materials, my information, my web announcements, you will continue to get them. We don't care whether you live in my district or not. You're always welcome to participate in the programming that we offer, and we're not kicking you off of any of our lists. But you may discover that you have a new senator who has other useful information and activities that they are providing as well. For those of you who are no longer in my district, it was an honor to represent you. As I said, you're always welcome to stay on my email lists and continue participating in our events. And for those of you who are new to my district, welcome, and I look forward to getting to know you as well in the coming months. And of course, because I did win re-election, I just want to thank everyone for their participation in voting, whether they voted against me or voted for me, because I'm your senator and I'm here to serve you. Now moving till today's event, we're going to hear from Eric Hausman, who is the volunteer outreach manager from the New York City Department of Aging's Health Insurance Information and Counseling Program, shorthand HIICAP. That's going to be the longest title on a card I've ever seen. Eric is an expert in all things Medicare and has a major following among my constituents who know Eric's the guy to find to get the answers. Eric will provide information about changes coming in 2023 to premium rates and deductibles for Medicare Parts A and B, and changes to Part D, your prescription drug coverage. Additionally, he'll share with us about Medicare Advantage and supplemental plans and programs that can help defray your Medicare costs, including your drug prescription costs. We've received a really large number of questions already, and I am certain we will get additional questions submitted during the event. Eric will answer as many general questions as time allows. If you have submitted a specific question about your personal health or coverage, we will probably be unable to get you an answer today, but you can please call the HIICAP phone number 212-602-4180. The number and the website will be listed in the chat, and they are more likely to be able to help you answer individual questions specific and unique to your situation. I know that some of you on Zoom today are city retirees and are concerned about potential changes in your retiree health benefits. My husband is a city retiree and he's concerned. At this time, my office is aware of what has been reported in the news media. The mayor's office has asked the city council to amend the administrative code, section 12-126, which would make it possible for the city to change retirees' out-of-pocket monthly fees if they choose to, it would make it possible for the city to charge retirees an out-of-pocket monthly fee if they choose to keep their original Medicare and their senior care plan instead of transitioning to the New York City's created Medicare Advantage plan. So far, the City Council has not introduced this legislation to amend the administrative code. It is also possible that the city could eliminate the current city retiree health benefits option completely and replace them with a New York City Medicare Advantage plan, although we still have not seen any details of what that plan actually would look like. For more information, if this applies to you, you can link to several newspaper articles and to the Office of Labor Relations website, which will be listed in the chat. If you are a city retiree and have questions about your health benefit options, please call the Retiree Health Benefits Program in the Office of Labor Relations, 212-513-0470. This phone number will also be listed on the chat. The town hall today is a general information session on Medicare, particularly designed for individuals who will turn 65 soon or are seeking to make changes to their current Medicare coverage during the open enrollment period, which ends on December 7th. So if you're one of those people, you're already on Medicare, but you want to make some changes in the options that you have available, just remember you want to absorb this information today and then don't spend too much time thinking it over because you only have till December 7th to implement the change enrollment period. Okay, I think now we're at the part where I hand it over to Eric. Eric, I want to thank you so much, and we will all be listening carefully to you.
Okay, thank you very much, and good afternoon. So as was said, my name is Eric Hausman, and I work at the New York City Department for the Aging with their HIICAP program, HIICAP. And we have volunteer counselors that help people with questions on Medicare. And if you or anybody else in New York City ever has a question about Medicare, you can reach out and speak with one of our HIICAP counselors. And today, I want to start by talking to you about enrollment in Medicare Part B. including some changes that are happening for next year. Now, whenever I speak to people that are new to Medicare, that are just turning 65, my first question to them will always be, are you collecting Social Security? Because I know if somebody's collecting Social Security prior to age 65, they're going to be automatically enrolled in both Medicare Part A and Part B. But today, many people are deciding to collect Social Security after 65. If that's your situation, you will not be automatically enrolled. And it'll be up to you to enroll in Medicare Part B during one of the Part B enrollment periods. And there are going to be some changes involved in these enrollment periods beginning in 2023. The first enrollment period is called the initial enrollment period. This is when people are first eligible for Medicare. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65. So that means the 3 months prior to the month you turn 65, the month you turn 65, the 3 months after that. If you enroll in Medicare Part B in any of the 3 months prior to the month you turn 65, Part B starts the first of the month you turn 65. If you enroll the month you turn 65, Part B starts the first of the following month. And that'll be true again next year. But if you enroll in those last 3 months after the month you turn 65, your Part B coverage is delayed. So if you enroll the month after the month you turn 65, Part B doesn't start until 2 months later. And if you enroll 2 or 3 months after the month you turn 65, Part B does not start until 3 months later. And of course, nobody knows that until they actually fall into that situation. But starting in 2023, you will no longer have that delay. And starting next year, for people that enroll in any of the 3 months after the month they turn 65, instead of Part B starting 2 or 3 months later, it will start the first of the following month. Now, for those that don't enroll during their initial enrollment period, they may have to wait till an annual period called the general enrollment period to enroll in Medicare Part B. That's every year from January through March. If you enrolled in the general enrollment period this year or in one of the preceding years, Part B did not start right away. Part B started July 1st. But starting next year, for anybody that enrolls in the general enrollment period, we will no longer have that delay. And if you enroll between January and March next year, Part B will just start the first of the following month. Now, there's a third Part B enrollment period. It's called the special enrollment period. And this is for people that may be able to delay enrollment in Medicare Part B at 65 without penalty because they are covered at 65 under their own or their spouse's active current employment. Not retiree plan, not COBRA, but active current employment. So if come 65, you're still working, or covered under a spouse is still working, especially if you're working for a large employer where the employer insurance would be their primary insurance, you may want to delay enrollment in Part B. And the special enrollment period allows you to do so. And then you can enroll in Part B later while you're working or within 8 full months following the month you're no longer covered through active employment. So if come 65, let's say you're still covered under your spouse who's working for the city of New York, you may delay enrollment in Part B. And then a couple of years later, when your spouse is ready to retire, you enroll in Part B using the special enrollment period. Hey, that's very common for people, again, that are still working or covered under a spouse who's still working at 65. Now, currently, the only people that can delay enrollment in Part B without penalty are the people that are covered under their own or their spouse's active current employment. Nobody else qualifies for the special enrollment period. But starting next year, they're going to expand the special enrollment period, where it'll also be available in certain situations. And I have 3 of those that are right here on this slide. The first is for people that delayed enrollment in Part B because they were misadvised by their health plan or their employer. So if their employer told them, for instance, they can delay enrollment in Part B without penalty because they're still covered under COBRA or retiree insurance and they were relying on that, they can now request the Part B special enrollment period. to allow them to get enrolled into Part B without having to wait till the next general enrollment period and without any late enrollment penalty. And if they cannot document that they were misadvised, they can accept written attestation from a beneficiary about how they were delayed because they were given the wrong information, again, by their employer or their health plan. There will also be a special enrollment period for people that were formerly incarcerated. So many people that are being released from prison after 65, the majority, are not enrolled in Medicare Part B, and they may have to wait till the next general enrollment period and be subject to a penalty in the past to sign up for Part B. But for people that are released from incarceration after 65, beginning in 2023, they will be able to sign up for Part B without having to wait and without being subject to a penalty. And then you might have somebody that has Medicaid, and we'll talk about Medicaid, excuse me, a little later, who did not enroll in Medicare Part B timely. And then following the end of the public health emergency, they might wind up losing their Medicaid coverage. This special enrollment period opportunity will allow them to enroll in Medicare Part B, again, without having to wait to the next general enrollment period and without being subject to a penalty. So these will all be protections for people that did not enroll in Part B timely, again, because they were misadvised by an employer, because they were released from prison after 65, or because their Medicaid coverage ends. That will allow them to enroll in Part B. And then another protection for people to be aware of is that, Part B enrollment is done through Social Security. And the Social Security Administration had acknowledged earlier this year that there were systemic problems with their phone lines, the national phone line and local office phone lines, where people may not have been able to enroll timely and may have missed their initial enrollment period, the special enrollment period, the general enrollment period this year, not because they were misadvised, but because they just couldn't get through on the phone to Social Security. Or they got through on the phone, but they were constantly disconnected, something like that. If that's your situation, you can request this equitable relief through the end of December this year, where you can request to be enrolled in Part B if you want it now or with retroactive coverage, and to waive any late enrollment penalty that you might have been subject to. So that equitable relief is requested, again, based on the phone issues that Social Security was having, by writing a letter to your local Social Security office. And then there's going to be a brand new Medicare Part B coverage for immunosuppressive drugs. So this is for people that are not Medicare eligible due to age, 65. They're not Medicare eligible due to disability, under 65. But instead, they're Medicare eligible due to end-stage renal disease, kidney failure. Now, for those folks, if they have a Medicare coverage transplant, kidney transplant, their Medicare coverage ends 36 months following the transplant. So unless they subsequently became eligible again for Medicare due to age or disability, they don't have any Medicare coverage, excuse me, after 36 months. Now that's very problematic because the immunosuppressive drugs that you need to take following a Medicare or following a kidney transplant, you need to take those for the rest of your life. And the Medicare covers those immunosuppressive drugs under Medicare Part B following a Medicare covered transplant. Now, what happens after the end of that 36 months? These people historically did not have coverage for immunosuppressive drugs. But starting next year, they're going to add new Part B coverage, Part B ID, solely for immunosuppressive drugs. So if somebody lost their Medicare Part B coverage at this point, they have an enrollment period. It began October. It'll run through the end of the year to get coverage January. If they lose their Medicare coverage anytime later, they can enroll in this Part B ID only for immunosuppressive drug coverage, not for any other Part B benefits, at any time without penalty. The enrollment can be done. But the coverage is only available for people that do not have other coverage for immunosuppressive drugs. So for instance, some people may have coverage through their own or a spouse's group health plan, through TRICARE for career military retirees, through Medicaid, the VA for veterans. If you have that other coverage for immunosuppressives, you're not eligible for this coverage. So what happens is if you want to apply for it, you must provide an attestation that you do not have other coverage for immunosuppressive drugs. The Part B ID premium next year will be $97.10. It may be subject to the IRMAA for people with higher incomes, and we'll talk about IRMAA coming up. And it's not covered completely, the immunosuppressive drugs. You still have an annual deductible and 20% co-insurance. And the Medicare savings programs that we'll talk about also today would also help you with the Part B ID premium for those that are eligible and apply. Let's get into the Medicare cost sharing for next year. Do you know Medicare Part A hospital insurance, most everybody gets for free for no premium. But Medicare Part B, there's a monthly premium. And next year, what's unusual is the premium's actually going down. So the premium this year, it's $170.10 per month. Next year, it'll be $164.90. And because the monthly premium for Part B is going down, so is the annual Part B deductible. So this year it's $233, next year it'll be $226. And that means the first $226 in covered medical expenses next year, that'll be the responsibility of the person with Medicare. Once they meet the deductible, Medicare usually pays 80% of what they allow. They're responsible for the other 20%, the Medicare co-insurance. Now, although most people pay the standard premium, $164.90 next year, some people will actually pay a higher premium because they have a higher income. And we have a chart to show you exactly what those premiums will be. So for next year, for people whose incomes are above $97,000 for a single, $194,000 for a married couple, they're subject to that IRMAA, that income-related monthly adjustment amount, that higher Part B premium. So what are we talking about in terms of income? We're talking about modified adjusted gross income. So that means your adjusted gross income, plus if you have tax-exempt interest income, those two lines on your tax return added together define your modified adjusted gross income. And they're looking at that from 2 years prior. So for 2023, they're going to look at your 2021 tax return. And if your income from that year, your modified adjusted gross income is above this threshold, you're going to get a notice from Social Security at the end of this year that you're going to pay a higher Part B premium for 2023 based on your 2021 return. Now, if you have what Social Security calls a life-changing event, a change in your marital status, more likely a change in your work status, you may be able to successfully appeal this higher Part B premium. So for instance, let's say somebody worked in 2021 and their income was high, but this year they stopped working and their income was much less. Initially, that person's going to get a notice from Social Security at the end of this year that they're going to have to pay a higher Part B premium for next year based on the 2021 tax return. They should then contact Social Security and let them know they had a life-changing event, and again, a change in your work they recognize as a life-changing event. And instead of basing your premium for next year on 2021, like they do by default, you want them to base it on the more recent 2022 tax year. And as a result, people can save, you can see from this chart, sometimes significantly on what their Part B premium would otherwise be. And then in the third column, you'll see that people that pay a higher Part B premium based on their income, if they also have a Part D drug plan, they pay an additional surcharge for their Part D drug coverage as well, based on their income. It's paid in the same way as the Part B premium. If you are collecting Social Security, it's taken out of your check. If not, it's billed to you directly. Now, what is going up next year is the Part A cost. Now, although most people get Part A for free, for no premium, there's a large deductible if you need to be admitted to the hospital. So this next year, for a hospital admission of up to 60 days, you're responsible for the deductible. You'll see it's $1,600 If you're in the hospital beyond 60 days next year, for the 61st through the 90th day in the hospital, you're responsible for a daily copayment. Next year, that'll be $400, and that's per day, per day. If you're in the hospital beyond 90 days, Medicare allows an additional 60, what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage in any combination. For those 60 lifetime reserve days, next year, you're responsible for a daily copayment. It's going to be $800 per day. For those that are discharged from the hospital to a skilled nursing facility for rehab care, Medicare will pay the first 20 days there in full. The next 80 days next year, you're responsible for a daily copayment. It's going to be $200 a day for days 21 through 100 in a skilled nursing facility. And then you'll see, although most people get Part A for free, for no premium, as long as they worked and they paid into Medicare, or had a spouse that did for at least 40 quarters, for those that have less than 40 quarters, they may be able to purchase Part A. And you can see the premiums there for those with less than 30 quarters, a little over $500 a month. For those between 30 and 39, $278 a month for Part A. Now, when I talk about Medicare Part A and Part B here, what I'm talking about is original traditional Medicare. And you see about the gaps in coverage, deductibles, co-insurance. Now let's talk about filling in the gaps. Some people on the phone today have retiree health insurance from their own or their spouse's former employer that fills in all or most of the gaps. Other people may have Medicaid in addition to Medicare, in which case Medicaid fills the gaps. But most people don't have retiree health insurance. Most people don't qualify for Medicaid. So what do? They might purchase a private Medigap, a Medicare supplement plan. You've seen them advertised on TV from AARP, I'm sure. And talking about AARP and Empire Blue Cross and Blue Shield, these are the two largest Medigap insurers in the New York City area. They are seeking rate increases for their Medigap plans, which will be effective the beginning of next year. So you'll see on this slide the current rates, monthly premiums for their plans, select plans, and the proposed new premiums for early next year. I just want to point out, though, when you look at Medigap plans, remember it's a standard benefit. So the same Medigap Plan G that you'll see that Empire might sell for over $320 a month next year, AARP sells it for will sell it for $295.75. So again, remember it's a standard benefit, and the same letter plan provides exactly the same coverage no matter who you buy it from. So it's well worth your while to shop around for the best deal on a Medigap plan. And if you want to know which companies sell which Medigap plan, and make sure you're looking at the latest rates, premiums, you should go to the New York State Department of Financial Services. This is the link. They regulate these plans, and they update the information every month so that you know if you're going to the website, you're always looking at the most current information. Now, the plans that I have here are some of the more comprehensive plans and the more expensive Medigap plans. Some people may be looking for a lower cost Medigap plan that's not quite as comprehensive. If they want a lower cost Medigap plan, they might consider the high deductible versions of Medigap Plan F or Medigap Plan G. Those plans cover everything the standard Plan F or G covers. But before they pay anything, you have to meet a deductible. Next year, that deductible is going up to $2,700. So if you have one of those plans, for instance, and you're admitted to the hospital, that $1,600 Part A deductible would go towards that $2,700. The $233 this year, Part B deductible, would go towards the $2,700. Okay? The 20% co-insurance would go towards the $2,700. And if you reach that $2,700, you'll get all the benefits of the standard Plan F or Plan G for the remainder of the calendar year, while saving on the premium over the course of the year. Another lower cost Medigap plan are plan letters K and plan letter L. Those plans, instead of covering, for instance, the entire Part A deductible, they cover Plan K only 50% of that, and Plan L 75% of that, up to a maximum out of pocket for the year. And that maximum out of pocket usually increases as it will for next year. So if you have Plan K and you're admitted to the hospital, that Part A deductible, you pay half, Plan K covers half. And that's how they're able to offer that plan at a lower premium. And remember, in New York State, unlike most states, for those on original Medicare with a Medigap plan, it's always open enrollment. So if you decide you want to switch your Medigap plan, you can do so at any time, regardless of your age, regardless of your health. If you live in New York State, you cannot be refused Medigap, Medicare supplement insurance. Now I want to talk about Medicaid and the Medicare savings programs as it relates to Medicare. Now we meet a lot of people that have Medicaid through the marketplace and are now becoming Medicare eligible due to age or disability. And what should they do? The number one thing they should do is enroll in Medicare, Part A and Part B. If they're collecting Social Security, it'll be automatic, but if not, they need to do that. And why should they do it? Because they cannot delay enrollment in Medicare Part B without penalty. And once they become Medicare eligible, Medicare is actually becoming their primary, their main insurance. Another thing they should consider is because they have Medicaid when they become Medicare eligible, they're automatically going to get extra help with Medicare Part D, which means they will get a subsidy that'll pay their Part D plan premium, so they get a Part D plan for no premium, and only small co-payments for their covered drugs. But also, because they get extra help, they're going to be assigned to a plan. But when you're assigned to the plan, you really got to be careful, because it's not based on your drugs or your pharmacy. It's just a random assignment. So it'd be much better for people with Medicaid that become Medicare eligible, rather than wait to be assigned to a plan, to actively choose a plan. Now, one thing they're going to be responsible for when they become Medicare eligible and enroll in Part B is the Part B premium. Right? But because they have Medicaid when they become Medicare eligible, they are entitled to reimbursement of the Part B premium. It's referred to as the MIPP, the Medicare Insurance Premium Payment. So for instance, if you have somebody that's collecting Social Security, has Medicaid through the marketplace, becomes 65, automatically they'll get A and B. They'll start taking the premium out of their Social Security check, but they will be entitled to this reimbursement of the Part B premium for as long as they continue to have Medicaid. Now, prior to the public health emergency, a lot of people who had Medicaid lost it when they became 65. And that is because there are different standards for Medicaid, pre-65 and post-65. Pre-65, it's much easier to qualify for Medicaid. There's a much higher income limit, and there's no resource or asset test. But once you become Medicare eligible, it's much harder to qualify for Medicaid because there's a much lower income limit and there's a resource test. So pre-public health emergency, many people had Medicaid through the marketplace before 65 and then wound up losing it at 65 because of their income or resources. But what they did in New York State for next year is they raised the income limits for Medicaid to match, for people over 65, to match the limits for people under 65. So people with Medicaid that become 65 next year, once the public health emergency is over, they will not lose their Medicaid. Nobody was losing Medicaid during the public health emergency, but once it's over, the public health emergency, they will not lose Medicaid next year because of their income. However, they may still lose Medicaid because of their resources, their assets. So you may have somebody starting 65 that has Medicaid through the marketplace that winds up, after the public health emergency, losing Medicaid, not because of their income, but because, again, their assets or resources are too high. They're going to increase the resource limits you see for next year for Medicaid, but again, that's for people over 65. But again, it's not the same as under 65 where there's no resource test at all. And then the most important thing that we're talking to people about is about the Medicare Savings Program. The Medicare Savings Program actually pays people's Part B premium. It puts that premium back into their Social Security check. There are 3 Medicare savings programs. Incomes are determined by income, as income determines which of the Medicare savings programs you'll be enrolled in. And the first is the QMB program. They're raising the income limits for that one to match Medicaid. So everybody that has Medicaid, that qualifies for Medicaid, that's because their income is below the limit next year, will also qualify for the QMB program, which will pay their Part B premium. Because they're raising the income limits for that so much, they're going to eliminate the SLMB program, and the QI program, which currently has an income limit up to $1,549 a month for a single, will have an income limit estimated for next year to be above $2,100. So if you know people that have incomes as a single person, $1,700, $1,800, $1,900, $2,000 a month, they're not eligible for this benefit now, but make sure you let them know that starting next year, they will be eligible for the Medicare Savings Program. Again, this is the most important message we're trying to get out, is the increase in the eligibility limits for this program. Also important to know is because many more people will have QMB next year, just to let you know about the extra benefit that QMB provides. So besides helping with the Part B premium, the QMB program eliminates any Part A or Part B cost sharing. So for instance, if you're on original Medicare and you have QMB, the doctor's not allowed to bill the 20% Part B coinsurance. If you're in a Medicare Advantage plan and you have QMB, the doctor is not allowed to bill any copayment for you. Okay, it doesn't matter if the doctor takes Medicaid, if Medicaid or QMB pays them anything with original Medicare, they usually don't. Okay? Doesn't matter if they ever heard of QMB. If you have QMB, the doctor is not allowed to balance bill you, meaning not allowed to bill you that 20% Part B coinsurance. And to remind people about that, if you're on original Medicare, when you receive the Medicare summary notice that you get quarterly when claims are submitted on your behalf, on the summary notice, if you have QMB, it tells you very clearly about QMB, and it tells you that you're not responsible to pay for any Part A or Part B cost sharing. So that's your proof in writing that you don't have to pay with Part B cost sharing with the QMB program in case a doctor or other provider is billing you incorrectly for instance, the 20% Part B coinsurance. So let's talk next about Medicare Advantage. Now, we spoke about original traditional Medicare, which might come along with the Medigap plan for people that don't have retiree health insurance. But there's a second way to get your Medicare, and that's to join a Medicare Advantage plan. And these are private plans that are contracted with Medicare to provide all of your benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that take that plan. If you join a Medicare Advantage plan, by so doing, you sign up with the particular insurer, whether it's Aetna or Humana or United Healthcare or Health First or Emblem or Empire or many others that offer the plans. And you get all of your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that accept that plan. And when you join a plan, under the plan, most services under most plans are not covered at 100%. Hey, you might have a copayment that you're responsible for when you get physical therapy, or when you go to the specialist, or when you're admitted to the hospital and for other services. But in fairness to the plans, although they have cost sharing for most services under most plans, it's not an unlimited amount for the year. All Medicare Advantage plans have a maximum out-of-pocket limit. Next year, that could be up to $8,300 in-network or up to $12,450 for in and out-of-network combined for a plan like a PPO plan, where you have both in and out-of-network coverage. Those are the highest limits any plan can have. Many plans have those limits for next year. Some plans have lower limits, and that's something to compare. So if you have a plan with an $8,300 limit and you get physical therapy, it's a $40 copayment, it goes towards the limit. If you see a specialist and it's a $45 copayment, that goes towards the limit. If you reach that limit, most people won't, but if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. Now, whether you're in original Medicare or you're in a Medicare Advantage plan, you're entitled to Medicare Part D. D is the prescription drug coverage. If you're in a Medicare Advantage plan, Part D will be included. If you're in original Medicare, you could purchase a separate standalone Part D plan. Next year, plans can have a deductible of up to $505. Once you meet the deductible, plans usually have a fixed copayment until you get to what they call the coverage gap, the donut hole. That will begin next year at the point that people get to $46.60 in total drug costs. At that point, they'll pay 25% of the cost of the drugs out of pocket, until for some people with very high drug costs, they may reach what they call catastrophic coverage. Catastrophic coverage next year begins at the point that they pay $7,400 in what they call TROOP. TROOP is the acronym, true out-of-pocket costs. So what does that include? Everything you pay, not the premium, but everything you pay at the pharmacy. Deductible, copay, coinsurance, the 25% during the gap. Plus there's one thing you don't pay, which still counts towards that $7,400, and that is for brand name drugs that you get during the gap. You're paying 25%. But what you don't see is of the other 75%, 70% of that, most of that cost is a drug manufacturer rebate. Even though you don't pay it out of your pocket, it still counts towards that $7,400, and that's very good for you because that gets you out of the coverage gap and to the catastrophic coverage for many people next year without having to pay nearly $7,400 out of pocket. And then once you get to that point, your drug costs go down, where you're paying no more than 5% of the cost of the drug, or a small copayment, which will match the extra health copayments next year, up to $415 for generic, $1035 for brand name drugs. And some people that have Part D also sign up for the New York State EPIC program to supplement Part D. For those that don't know, EPIC is for New York State residents that are 65 and over, that have incomes up to $75,000 for single, $100,000 for married couple. EPIC is based on eligibility last year's, the prior year's income, and they don't look at your assets or resources at all. But you may have noticed there's a new EPIC application, and not only does it ask for your prior year's income, but it also asks for your current income and your current resources. And the reason they're asking for that information is because EPIC is using that information to apply to Social Security for people that appear to be eligible for extra help but are not receiving that benefit, to see if they can get that additional assistance to help with their Part D drug costs. Now, when you're filling out that application, although it's longer now, you may be able to skip some sections of that. So for instance, if your income is well above the extra help limits, you don't need to provide your asset or resource information because it's obvious that you're eligible or that you're not eligible for extra help just based on your income. So look at the instructions carefully when you're completing that. Also, this is the link to a downloadable, fillable version of the EPIC application. But you can't apply online. You still have to print it, sign it, and mail it or fax it to EPIC for processing. And then I want to tell you about some changes that are happening to Medicare Part D as a result of the Inflation Reduction Act, which was passed this year. So vaccines that are covered under Medicare Part D, including the shingles vaccine, starting next year, will be covered at 100%. The same way the flu and pneumonia vaccines are covered under Medicare Part B medical insurance today at 100%. Also next year, for people that use insulin that don't have extra help, those people that have covered their insulin covered by their Part D plan, the Part D plan will be limited to charging no more than a $35 copayment monthly for their covered insulin. It will not be subject to any Part D plan deductible. And again, it might even be less than 35, but no more than 35 per month. Starting in 2024, People that have partial extra help, they will instead have full extra help, so they'll get a larger benefit to help with their Part D drug costs. And the big change for 2024, for people that reach that catastrophic coverage, instead of having a 5% cost sharing, they'll eliminate that 5% cost sharing. And then the biggest change will be in 2025, where for the first time, there'll be a new out-of-pocket limit for Medicare Part D, where today there's no out-of-pocket limit at all, not to exceed, starting that year, $2,000. So that would be a very large change to Part D as a result of the Inflation Reduction Act. So everybody knows it's the annual election period, October 15 to December 7th, where people can switch their Medicare Advantage and/or Part D plan to be effective the 1st of January. If you do decide on a Medicare Advantage plan for next year, there's a second enrollment period called the open enrollment period, January through March of each year, where you're able to switch to either another Advantage plan or to original traditional Medicare. One time, January through March, to be effective the 1st of the following month. This open enrollment period is also available for people that are newly eligible for Medicare. So if, for instance, you take a Medicare Advantage plan, when you're first eligible for Medicare at 65, you have the first 3 months of your entitlement to switch to another Advantage plan or original Medicare. In addition to that, if you take a Medicare Advantage plan when you're first eligible for Medicare at age 65, they have a special enrollment period, it's called the SEP 65, that allows you within the first 12 months you're eligible for Medicare and enrolled in a Medicare Advantage plan to switch to original traditional Medicare. So look at this. You might see that as an extension of the open enrollment period. So for instance, if there's somebody on the phone today who turned 65 in October, and you took A and B and an Advantage plan effective October 1st, you can use the open enrollment period, October, November, December, to switch to another plan or original Medicare, and then use the last 9 months of the SEP 65, you can switch to original traditional Medicare. So this is a really important protections for people, again, that take a Medicare Advantage plan when they're first eligible at 65, but realize within that first year that they want to make a change. In addition, there's a special enrollment period for people with extra help, including people with Medicare and Medicaid, where unlike most people, where they can only change this time of year, they are actually able to change as often as once per calendar quarter in the first 9 months of the year. So if you know somebody with Medicare and Medicaid, they can change their plan one time between January and March, one time between April and June, one time between July and September, to be effective the 1st of the following month. During this last quarter, they have the same October 15th to December 7th as anybody else. And then for your EPIC members, they also have their own special enrollment period to allow them to make one additional change each year into or out of a Medicare Advantage and or Part D drug plan. So for some people, it's worth it to join EPIC just to be able to change plans without having to wait till the next year. And people can sign up for EPIC at any time of the year that they may be eligible. For those people that have a Medicare Advantage plan from the Emblem, their Emblem Health VIP Essential Plan, or that have a Medicare Advantage plan from Bright Health, or if they live in the Bronx from Oscar, those plans are ending the end of the year. So for those individuals that are in a plan, if they do not choose another plan for next year, January 1, by default, they'll have original Medicare. If that person also has extra help, they'll put them into a Part D plan for next year. But if they don't have extra help and they don't choose a plan, they could wind up January 1st with no Part D drug coverage at all. There is one Part D plan for those that are in original Medicare from IRMAA, the IRMAA Basic RX plan. That plan is currently a benchmark plan this year, which means it's a plan that's available for no premium for people that have full extra help, including people with Medicare and Medicaid. But next year, the plan premium for that IRMAA plan is going up. and it's not going to be a benchmark plan for next year. Some people may be reassigned to a different benchmark plan for next year, and they'll have no premium if they accept that reassignment. Other people, if they don't choose a benchmark plan, they may have to pay the difference in premium above the subsidy amount. And next year, that difference in premium will be $3.50 a month. So I know we're going to be hearing from people next year who will say, you know, I have this Humana plan. It was free before. Now they're billing me $3.50 a month. Why is that? Well, because the premium went up, and the subsidy that they get is no longer enough to cover the entire Part D plan premium. Also, for those that are in a Cigna Essential RX plan, this year it has a $42.30 premium. Cigna is not continuing to offer that plan next year. They do offer other plans, and what's going to happen is they're moving them, these individuals will be moved to the Cigna Extra RX plan. That's a more expensive premium, $75.50. And unless they opt to choose a different Part D plan for next year, that's what they're going to have by default. Cigna, for the first time, will also have new Medicare Advantage plans for next year in the New York City area, the True Choice Medicare PPO plan and the True Choice Courage plan. The first one includes Part D. The second one is without Part D. Health First has a new Signature PPO plan for next year. They also have a Signature HMO plan that's not new, but the PPO is going to be new. And remember, with the PPO plan, unlike an HMO plan, where you're limited to in-network providers only, unless it's an emergency, with the PPO plan, you're able to use both in and out of network providers that are in Medicare. And you might have noticed if you're looking at United Healthcare Medicare Advantage plans, that their HMO plans currently will now be HMO POS plans, point of service plans. And with a point of service plan, the difference is that they have an out-of-network benefit, but it's a limited out-of-network benefit. So it's specifically for United Healthcare, their members can go out-of-network next year with the plan, but only for dental, not for medical. So for doctors and hospitals, they may continue to use in-network providers with their HMO POS plans in 2023. And then the last thing I wanted to mention today, just briefly, is about what Senator Krueger touched on for New York City retirees with Medicare. New York City retirees with Medicare were initially this year going to be moved to the new NYC Medicare Advantage Plus plan, a Medicare Advantage type plan. And unless they decided to actively opt out to remain in their current New York City retiree plan. But because of a lawsuit that was put on hold, and currently all New York City retirees remain on their same plan with their same premiums and costs. However, there was one change this year that I want people to be aware of, and that's for New York City retirees that have the GHI senior care, as most New York City retirees with Medicare do. That acts as a supplement to Medicare. It's comparable to the private Medigap plans that somebody might purchase from AARP or Empire. It does not pay the Part B deductible, plus they have their own $50 deductible on top of that. Once you meet the two deductibles, historically, they paid the 20% coinsurance, but starting this year, there are new $15 copayments for many services, and as a result, the coverage is not quite as complete as it was prior to this year. I have a link here to a letter that they sent out to their members to let them know about the change. And that change was not impacted in any way by the delay of the NYC Medicare Advantage Plus plan. So I know that was a lot of information in a very short period of time, and I'm happy to answer any questions that you might have.
Thank you, Eric. That was an enormous amount of valuable information in a very short period of time. And again, for everybody who's listening, there are lots of links that have been provided in the chat for follow-up, but more importantly, for everybody who's watching today, if we have your email address because you registered or you want to contact my office now and add your email for us, we will be sending out the tape recording of this whole event, plus the PowerPoint, plus the list of all resources and contact information that's been provided in the chat here today. So don't panic and think you had to write everything down and it was too much information. The truth is we make it too complicated to get access to health insurance and to even understand what our options are, which is why we think it's so important that we have programs like HIICAP here at the New York City Department for the Aging and terrific technical experts like Eric, who when you call them, and again, I'm going to remind you their phone number at HIICAP, 212-602-4180. I think that this office within Department for the Aging has been the little secret golden gift of city government to older New Yorkers, because we all hit these ages and suddenly you have to make all these new decisions about health insurance. What can you keep? What don't you need to keep? What should you buy as a supplement? What does it mean if you're still working but hit Medicare eligibility age? There's just endless questions. And for now 20 years as a state senator, my office has been directing people to HIICAP, using their experts to help us figure out complicated issues. And I just, on behalf of my entire office, I want to thank Eric and the whole HIICAP team for being there and doing what you do, because it's incredibly valuable to people. Having said that, thank you, Eric. Having said that, we had a lot of questions before we even opened up this webinar today, and I am quite confident that more of those questions have been piling in that my staff will attempt to forward to me as I am going through first questions that were given to us in advance, so we have them written down. We won't have enough time for every question, I can guarantee you, which is again a reason why it's important to know about HIICAP and how you can find them after this event, particularly if it's complicated / personal for you, because the truth is there are different benefit options out there and one size doesn't fit all. So that if you know that you are suffering from X disease, or you need Y treatments, or you need expensive prescription drugs, some options might be better for you, while your neighbor might not have the same issues, and so the right answer for you might not be the right answer for your next door neighbor. So, which is why it is so important to do follow-up. And again, there's no reason for you to even want to share personal information with us over a webinar. That's okay. There's healthcare privacy rights. And if you call HIICAP and walk through the concerns, you know that you will have a personal and private conversation with someone where you might be sharing information that you don't want to share with your state senator or on a webinar today. So just remember that we're also in that area where we want to get the answers and we want to provide the information, but we don't want to violate anybody's right to privacy and confidentiality about their own healthcare concerns. And so asking it in public or even typing it to me for a public question is not the only way to get the answer. With that, though, I'm going to start down through some of the questions. So some attendees are going to turn 65 in March, August, or September of next year, 2023. When should they be signing up for Medicare? And do they have to enroll in 22 for some reason before we hit next year?
No, so the first thing to know is whether they're going to be collecting Social Security prior to turning 65. If they will be, they'll be automatically enrolled in Part A and Part B. If they're not going to collect Social Security, though, until after 65, then they're not going to be automatically enrolled. And if they want to enroll in Medicare to be effective when they're first eligible, March or August or September, they can enroll in one of the 3 months prior to their 65th birthday month. And if they do, their Part A and Part B will start the first of the month they turn 65.
Okay. So we talked a lot about the special enrollment period, and that it's, I guess, done in December 7th for now. So is there always a specific time limit? And what do we need to do if we've suddenly listened to you and said, oh, I've got to be applying before December 7th? What am I supposed to do now?
Well, the October 15th to December 7th, that's what we call the annual election period. And that's the period of time in which people can change how they get their Medicare coverage for the next year. So for instance, they can go into or out of a Medicare Advantage plan. They can switch back to original Medicare or the other way around. If they're in original Medicare, they can change their Part D plan. And this is the time of year to assess what they have and to see if there's a better plan for them for the new year. And that's something that we can help them with and commonly help people with this time of year.
Great, thank you. Can you please explain how regular/original Medicare and Medicare Advantage plans are different, and just sort of why I would want to shift off of original Medicare into an Advantage plan?
Yeah, well, that's a really important question. So for those that don't have retiree health insurance and don't have Medicaid, it really comes down to these two choices. It's original Medicare, which could come along with a Medigap plan, or it's a Medicare Advantage plan. It's one or the other. So just very basically, the reason people would choose original Medicare with the Medigap plan is to have the most choice of providers across the country, doctors and hospitals, and the most complete coverage, depending on which Medigap plan they choose. That's the upside. The downside is high premium for the Medigap plan, plus you need to buy a separate Part D plan. So you pay more in premiums, but in exchange, more choice of providers, more complete coverage. The reason people would choose a Medicare Advantage plan instead is to save on those premiums. You don't need the Medigap, you don't need a separate Part D, it's all included. Some plans are available for as low as no premium. Plus you get some additional benefits that Medicare doesn't cover, like dental and vision and hearing and a gym membership. But what's the downside? If it's an HMO especially, unless it's an emergency, you're limited to doctors and hospitals that participate. Even if you don't pay a premium, like we talked about, you still pay on the other end when you access care, co-payment or co-insurance for most services under most plans, up to a maximum out of pocket for the year. Plus, it's managed care. So they cover your mental health and your physical therapy and your planned surgery, but you may need to get pre-approval, prior authorization before those services will be covered. So like you said, there's no one size fit all. And, for many people, original Medicare with a Medigap is the better choice. But for other people, they do very well with Medicare Advantage. And now's the time to make that decision for 2023.
Great. And you talked a bit about that some people are eligible for Medicare because they hit 65, and other people are eligible because they have some kind of disability. Is there any differences in the Medicare options regarding whether you're disabled or above a certain age?
No, it's actually the same Medicare coverage. So whether you're Medicare eligible due to age or disability, it's the same Part A and Part B, the same Medigap, Medicare Advantage, Part D choice. The only difference is, for us, is with EPIC. For the New York State EPIC program, you need to be literally 65 or over. Okay? Disabled people with Medicare under 65 would not be eligible for EPIC. But otherwise, everything is the same with Medicare. And I should also say, although we're the New York City Department for the Aging, we also serve people with Medicare that are eligible due to disability under 65. So it's no problem for them to contact HIICAP for assistance.
Great. Thank you for highlighting that. All right, so this time of year, because it is open enrollment time, we are inundated with really god-awful TV commercials from personally, once upon a time, famous people you forgot were still alive. And they're advertising these specialized Advantage plans where, depending on your zip code and you're calling fast enough, they might actually send you additional money every month to supplement your Social Security payments. what is this all about? I mean, my feeling is, oh, run the other direction, but somebody must be buying their plans because they're paying a lot for TV commercials.
So yeah, so we certainly get a lot of inquiries from people that understandably that are concerned or confused by the amount of the marketing, whether it's TV advertisements or things that they get in the mail or see in public places. But one thing, when you're talking about the premium reduction, there are some Medicare Advantage plans that actually pay part of the Medicare Part B premium, and they pay it directly to Social Security. So if you have the premium deducted from your Social Security check, which you would if you were collecting Social Security, because they pay part of the premium, not the whole premium, but part of that, your Social Security check would actually be increased as a result. And that's what that commercial is referring to. That commercial, though, these are for national audiences. So that's why they ask for your zip code, because in some parts of the country, they may have a lot of plans that pay a portion of the Part B premium. In the New York City area, we have a handful that pay a portion of the premium. Most of them do not provide that additional benefit, but there are a few that do.
But you do have to be careful that even if they're offering you some kind of discounted cost for your premium, they may not actually be providing the healthcare benefits that are most necessary for you. And I guess the cynical side of me assumes they're probably benefit packages that don't allow you to get a number of different things because that's how they're saving enough money to give you a discount in some way. Is that fair?
Well, I think with Medicare Advantage plans, the people's first concern is not the premium reduction or some of the additional benefits, the dental or the vision, although they might appreciate those things. Their first concern is the network of providers. Because most of the people that we speak to with Medicare, they have a particular doctor or doctors that they are committed to, that they would not be willing to switch. Or if they had a need for hospitalization, they have a connection with a particular hospital that they would want to use. So the way those individuals choose the Medicare Advantage plan is they check with their providers and then see which Medicare Advantage plans they would accept or participate in. And that's how they can narrow down their choice, since there are so many plans to choose from for us in New York City. And that's where we would encourage people to start, again, with their providers rather than with these extra benefits.
And I would want to also really encourage people to do the same, because one of the issues we hear about all the time in my district is that they can't find doctors who will take them as Medicare patients. And so you really don't want to be giving up a doctor that you like and trust and who knows you, and then learn that there's really not even that many options for you to switch to in a Medicare plan that isn't going to include your doctor in it. Because that's I think, maybe unique to my district because I hear it a lot. But there are more and more doctors who apparently won't take Medicare. And I'm just wondering whether you are seeing that or hearing that at HIICAP also.
Yeah, so if we're talking about traditional Medicare, original Medicare, as opposed to the Medicare Advantage plans, there are some providers that have opted out of Medicare. That's the term that they use. And when a doctor or other provider opts out of Medicare, they cannot bill Medicare, and Medicare pays nothing at all for their services, and they're not limited by Medicare as to how much they can charge. They can bill and collect up to their usual fee, with, again, no reimbursement at all from Medicare. Most providers have not opted out of Medicare because most just can't do without the Medicare business, but we certainly see that's more in Manhattan than we do in other places. And we see this more with mental health providers, psychiatrists, psychologists, social workers than we do with other specialties. We also see this with surgeons that are affiliated with the Hospital for Special Surgery. I run into that there as well, where they may have opted out of Medicare. But still, the majority of providers are part of the Medicare program. And if you're in original Medicare, you're only going to get coverage if you use a provider that's part of Medicare.
Thank you. So if I elect to remain on my spouse's medical insurance through his or her work past the age of 65, will I face some kind of penalty when eventually switching to Medicare when my spouse retires?
Right. So if you are covered under your spouse's active employment when you turn 65, then you can delay enrollment in Medicare Part B and then sign up later without penalty using that special enrollment period that we spoke about before. I would also want to make sure that your spouse is working for a large employer, which for people over 65 would be an employer of 20 or more individuals, because in that case, the employer coverage would be the primary, their main insurance, and you can, again, delay enrollment in Part B without penalty. If it's a small employer, Medicare would actually be your primary insurance, and you might have to wind up enrolling in Part B anyway at 65.
So if I sign up for Medicare Part B after 65 while still working and covered, but I'm near retirement, should I still get a Medigap plan at this time?
If you're already enrolled in Part A and Part B and you have coverage through work as well, then you probably can't purchase a Medigap plan because they're not allowed to sell you a Medigap plan if you have duplicate coverage. So if you have employer health insurance coverage that supplements Part A and Part B or is even your primary insurance, you probably can't buy a Medigap plan. But once that ends, and you're enrolled in Part A and Part B, you can purchase a Medigap plan at that point, assuming you won't have retiree health insurance when you stop working.
So if I retire and it's not an open enrollment period, can I just jump in and buy Medigap at that time?
Yeah, if you live in New York.
Next open enrollment period.
Yes, for those that live in New York State, it's always open enrollment for Medigap insurance. So as long as you have Part A and Part B and you're on original Medicare, you can purchase a Medigap plan at any time. Now, what you may run into, and you may have seen, is waiting periods for pre-existing conditions of up to 6 months, which most of the Medigap insurers have. So that means although they'll sell you a plan at any time, they may not cover a service related to a pre-existing medical condition for up to that first 6 months. However, most people we meet that buy a Medigap plan are able to avoid the waiting period because they've had some sort of prior credible coverage that can count towards that. So for instance, if they're coming from an employer plan, like that person was asking about, or a retiree plan that they've had for years, and then that ends, and they buy the Medigap plan, they don't have to worry about pre-existing conditions. The time they were on the employer plan will satisfy that with the Medigap insurer.
So we talked a couple of times about how as long as you have A and B, what if you're 65 and you're employed and your health benefits are going to continue? Do you have to apply for Medicare at all at the time you hit 65? Are you going to face any kind of penalties if you delay doing that?
Now, you can just delay enrollment in Medicare when you're 65, again, if you're covered under your own or your spouse's active current employment. And that's, again, very common for people that are working for a big employer, where it's not worth it for them to pay the Part B premium to have that as a second insurance. They delay Part B and they save the premium. And then when they stop working or their spouse stops working, they enroll in Part B then without having to wait and without paying the penalty using the special enrollment period.
And can your employer make you move into Medicare when you hit 65, even though you're still working and you've been on benefits? Do they control that?
Well, it depends on the size of the employer. That's why I was saying for the other person, the size of the employer to make sure, because if it's a small employer, although less than 20, where Medicare would be primary, although Medicare is okay with you delaying without penalty, if you don't take Part B, you might find you don't have health insurance because the employer doesn't want to pay without Medicare. Because if you had Medicare, Medicare would pay most of the cost. But if it's a large employer, they can't make you enroll in Medicare. And even if you had Medicare, it's the employer insurance, which is your primary, your main insurance.
So, in quite a few of my constituents spend certain months a year in warmer climates. Florida is the obvious example. So, if I buy my Medicare Advantage plan here in New York, and then I end up in Florida for 4 to 6 months a year, is it what's called portable? Am I going to get health insurance down there, or am I going to be in a problem situation?
Yeah, so with the Medicare Advantage plan, if it's an HMO plan, unless it's an emergency, you're limited to a network of doctors and hospitals. Some HMO plans only have providers that are in our region. Other HMO plans are national, though, and they may have providers in other states as well, including in Florida. So that's something you would need to find out from the plan, ideally before joining. Also, there are some Medicare Advantage plans that are PPO plans that allow you to go to any Medicare provider because it's both in and out of network coverage. But even with the PPO plan, you would want to make sure, if you have an idea about your providers in advance, that they're in network. Because if they're out of network with the PPO, although they could be covered, it might be more costly to you. And you might even have to pay up front and then seek reimbursement from the plan. Now, the other option is for people that are in Florida half the year is to have original Medicare with a Medigap plan. The advantage of original Medicare with a Medigap plan for people that live in other states, as well as New York, is you would have the same coverage in Florida, in Arizona, in New Jersey as you do in New York. And that's a big advantage, again, for people with original Medicare and a Medigap plan.
Okay. Wow. I'm sorry, there was at least one question I saw somewhere about what about if you spend time out of the country? Some people spend a few months in Mexico or Central America. So if you're traveling just on a trip, or if you travel for a couple of months every year, is that same rule apply that we just talked about in Florida, or are there different rules for international?
Different rules. So Medicare itself does not cover you at all for services outside of the United States and its territories, no coverage under Medicare. If you purchase a Medigap plan, most Medigap plans pay for foreign travel emergency services. So for emergencies that happen during a trip outside the United States. If you're in a Medicare Advantage plan, Medicare Advantage plans, some plans, but not all, provide coverage for worldwide emergency care. And you would have to look at the individual plan to make sure you had that coverage and the limits of that coverage. Because that's an additional benefit, again, that Medicare itself does not provide.
Right. So some of us hear about these things called high deductible Medigap policies. What are those and why would I want one?
Yeah, so I mentioned those earlier when we talked about Medigap insurance. Yeah. There are high deductible, Plan F for people that became Medicare eligible prior to 2020. They would be eligible to buy that, or a high deductible Medigap Plan G. And these plans are very similar. And the reason somebody would purchase those plans are that they have a low premiums. And the reason that they have low premiums, you get one of those plans, for instance, for about $60, $70 a month, whereas the typical Medigap plan might be $200 or $300 a month. And the reason they have a low premium is because of that high deductible. So when you're in a high deductible Plan F or Plan G and you have services, the Medicare deductible and the 20% coinsurance is applied to that high deductible amount. And because it's applied to that high deductible amount again, and you have to pay more initially at the beginning of the year out of your pocket, that's how they're able to offer that at a lower premium. And some people really like those plans because it's inexpensive relatively, and it allows them to be in original Medicare and have the most choice of providers. And although they have to pay out of pocket at the beginning of the year, it protects them from catastrophic coverage, from catastrophic expenses, I should say, right? So they have that limit on the deductible. And if you meet the deductible, you would have all the benefits of the standard F or G for the remainder of the year. Other people, though, they're willing to pay more for their Medigap plan because they want to have more complete coverage. and they would be interested more in the Plan F or Plan G or Plan N that are very popular also. So it's very individual. And again, remember, it's New York State, so it's always open enrollment for Medigap. So if you tried the high deductible G and you don't like it, you could always switch to the regular G or N at any time, regardless of your age or your health.
Thank you. Wow, we have endless questions in about 5 minutes. So an example that was given was someone who said, I have Medicare Part F, and you just talked about that and what that is. And they're asking, does it make sense to change to Medicare Part D? Is that a smart move? Will I save money by doing so?
So I think this person is asking if they have original Medicare with Medigap Plan F as in Frank, and they're thinking about going to Medigap Plan G as in George instead.
Yes.
Right? So
Yes.
The only difference between those plans is that Plan G does not cover the Part B deductible. That's the annual deductible, which next year will be $226. Now, if you look at the difference in premium over the course of the year with F and G, the amount that you would save in premium with Plan G is actually more than that $226 deductible. And for some people, that's the argument to be made in favor of Plan G. You're saving more in premium than you're losing in benefit. Although other people are willing to pay more for Plan F just to have the most complete coverage and the convenience of not seeing any doctor bills after Medicare.
So there's a lot of endless questions, as I said, that we're not getting to, but one that I think a lot of people are interested in is, can you talk a little bit about what coverage for dental and eye care might be available and that people could be looking into for themselves?
Yeah, so Medicare itself does not cover for dental or for vision, or the other one we hear a lot is hearing aids. Medicare provides no coverage. However, if you're in the original Medicare, if you're in a Medicare Advantage plan, those plans typically will provide some limited coverage towards these things that Medicare doesn't. So some Medicare Advantage plans just cover preventive dental, routine dental. Others offer what they refer to as comprehensive dental, where they provide coverage for procedures. And you have to look at the details. For some plans, it's only up to a maximum dollar amount for the year, $1,000, $1,500, $2,000. Others don't have a limit. For vision, they might give you some money towards eyeglasses every year, every 2 years. So those are additional benefits. But otherwise, there are some things you see advertised that are plans that cover just for dental or vision, but those plans are not standardized by the government, so we really don't counsel people about that. And the way that I like to handle that is I usually refer people to ask their dental provider or their optometrist if there are any plans that they might accept or that they might recommend. Some of those plans might provide just a discount for services. Others might provide actual coverage. But it's really outside of Medicare, if you're outside of the Medicare Advantage plans.
Okay, I'm going to make this the last question because I think it covers a lot of people's concerns. That they hear that Medicare Advantage is okay if you're relatively healthy with few medical needs. But then after a few years, and you get sicker as you get older and you have more medical needs, you want to switch to original Medicare with perhaps a supplemental Medigap insurance. One, how difficult is this? Will the person have to pay higher premiums than they would have if they just stuck with original Medicare from the beginning? And will they face this problem of having pre-existing conditions leaving them, without the coverage they need?
Right, so that's important too. So everybody with Medicare that's in a Medicare Advantage plan that wants to switch to original Medicare has 2 opportunities to do that each year. They can do that once now during the annual election period, October 15 to December 7th to start January 1. They can do that a second time between January and March to be effective the first of the following month. After March, for most people, whatever plan they're in, they probably can't switch unless they're also eligible for EPIC, in which they can make one additional change each year, which could also be from an Advantage plan to Original Medicare. If you switch to Original Medicare and you live in New York State, you could purchase a Medigap plan to go along with that at any time. As long as there's no break or just a short break of less than 63 days from when your Medicare Advantage plan ends and your Medigap plan begins, they will credit the time on a Medicare Advantage plan towards meeting the waiting periods with your Medigap plan. So if you're on a Medicare Advantage plan, let's say this entire year, but January 1st, you're going to be on Original Medicare with the Medigap, you don't have to worry about pre-existing conditions. This year with the Medicare Advantage plan will satisfy the waiting period with the Medigap plan. And the rates are the same. In New York, we have community rating for Medigap insurance, which most states don't have. And regardless of your age or your health, if you live in the same area and you purchase the same plan from the same insurer, you'll pay the same rate. And that's why on the slide earlier, when you saw the rates for next year for AARP and Empire Blue Cross, there was just one rate listed for each plan because your age does not determine your rate. It's community rating in New York.
Well, now you all know why I was so happy that Eric was going to be with us today, because we have learned an enormous amount, and we have probably also learned that if we have questions about our coverage, we want to call HIICAP and have a personal conversation with someone who can answer all of our unique storylines, because every one of us is different. So I want to thank Eric so much for participating. It was so
Thank
helpful.
you.
Thank you. I think we had about 350 people listening today, and more will be watching as it sits on our website. So really appreciate it. And I want to let everybody know that our next event will be myself co-sponsoring an event on Tuesday, December 6th, starting at 7 p.m. And it's going to be co-sponsored with Manhattan Borough President Mark Levin, who is we're going to talk about Local Law 97, which is an ambitious plan to reduce greenhouse gas emissions from buildings. So if you live in a building here in New York City, which probably most of us do, there are new local laws that are going to be affecting us and our buildings, and they're crucially important for decreasing greenhouse gas, but they might also require steps to be taken by our building management or ourselves if we live in the kind of building that doesn't have building management. So the town hall will help building owners and co-op boards learn how to meet the new energy efficiency standards. Again, I want to thank all of you for participating today. I want to thank my staff, with whom I could never get any of this done. And I also want to wish everybody a very happy Thanksgiving, which is coming up next week. And I look forward to seeing you on the streets of the community or on my webinars. Take care, everyone. Bye.